Good morning, everybody. Once again, Dr. Salim is here with you guys. Today's topic is to talk about the artifacts. What are the artifacts and how it created? And what are the ways how we can evade from the artifacts? So let me try my best. Due to my knowledge, let's see if I can explain it a little bit. So let's see, first of all, we should know what is artifact actually. There will be a lot of definitions for the artifacts, but I think the easy definition is that artifact is an error image. It's not a real image. It's a false image. It's a false information. It is the information which are not there, and we see it on the picture. So what are the causes of this? Why this happens? And which picture we can call that this is artifact? Like, which picture should be named that this is an artifact? Now, first of all, I'm sorry. Let's see what is artifact. Like when we can call the picture which is an artifact. The picture when we take the picture on, for example, on the longitudinal or sagittal plan, we see some structure differently when you turn it to the transverse or to the short axis, and then those structures or those extra stuff you saw in the picture earlier, it disappeared. So it means the picture which give you two different information from the sagittal to the transverse or to the oblique plans or the waves. So it means they are not always available in all of the plans. It just shows some stuff in the one plan, not on the all. For example, we see artifact, like which picture should be called as an artifact. Sometimes some stuff are missing in the picture. In the real anatomy, it's there, but in the picture, we don't see them. It's not available on there. Or maybe they're improperly located. They're not properly located. So they are displaced, I can say. It just from it's supposed to be in a proper area or location. It just changed from that area. So that's another one. Or we can say they have a improperly brightness. I'm just giving you one example. For example, if we see enhancement artifact. So in enhancement artifact, you see below a really brightness. It's supposed to be not, but it's a brightness. So it's the attenuation matter. It means that's an artifact picture. That's not a real picture. Or maybe the shape change. So you see, and it does not look like correct shape. It's the shape is changed. It's a different shape. Or the size is different of the structure, anatomy, organ. It's differently. Or at the end, we can say something is actually not matching or corresponding to the anatomy, to the true anatomy. So these are all the pictures we name them as an artifact. Now, the question is when the artifact can be called as an artifact. Like, what are the causes of the artifact? Let's talk about that. There are some stuff like some rule regulations in the sonography or in the ultrasound physics, we can say. For example, there are a few things which causes the artifact to be created, to be there. Like, for example, number one, we can say violation of assumptions. There's many assumptions, but these 6 assumptions, as I also mentioned them in my book, Concept of Sonography. So 6 assumptions. When the sound violates those assumptions, it will create a wrong picture. It will create an error. It will create a picture which is not reading the real anatomy. It will be different from the anatomy. So that will be an artifact. That's one, assumption of violation. Secondly, equipment malfunctioning. Maybe the equipment you're using, the machine, the system, the scanner, there is something wrong with either the probe, with the keyboard, with the wires, with the monitor. One of the knobologies, one of the knob is not working properly, or so something is missing or damage to this whole system. So it's the malfunctioning of the system, we can say, or equipment. And then it can be operator error. For example, somebody who's scanning, maybe they don't have a good experience. Maybe they're scanning from the wrong window. And then you see a lot of shadow, everything is not visualized, and this is their experience problem. Maybe they have a lack of experience, or I can say maybe somebody's really in a hurry, they're not properly paying attention to the picture. Or the last one, the fourth one, cause it can be just I also mentioned them in my book too, because it can be that is the error of, or we can say the error or the interpreter error, the person who finalized the report, or maybe who read the picture and write their preliminary report. So either it's a preliminary report or maybe it's a final report. So the reader, the one who have to put their impressions, where their findings are, just to explain the picture. So these are the four main causes of the artifact that it will create, or it will just come, and then the picture is messed up. The picture is not really representing the anatomy, because it's different. It's not correct picture. It's error. It's a mistaken picture. So artifacts, I think, it's really important. Why? One of the biggest reason is, if I represent artifact, like we see artifact and we name it as a pathology. So this patient can reach from our scanning all the way to the operation room. Why? Because we represent something which was an artifact, which was not reality. It was a false picture. It was maybe one of the rule regulation, or one of the assumption was violated. And then we couldn't know about that. So physics, maybe, or we forgot. And then the picture, there is a picture, but that's not really matching to the real anatomy of that human body that we're scanning. And then maybe the next step of this is a surgery. And then because the surgeon or the next doctor, the one who take their decision, and they send the patient to us as a radiology department or ultrasound department, just they want our opinion. And maybe you are the only modality to use that ultrasound. And then we give them this error picture. And then because of the error picture, because of the wrong picture, because of the mistake picture, so maybe they will take a decision, let's do the surgery for the patient, because there's something seen which is unusual, which looks like a pathology, but who knows, that's a pathology or that's an artifact. You know what I mean? So this patient can go to the next step, which will be a surgery for no reason. Why? It was just error. It was not when they open the abdomen or that area where we just give them the picture and everything looks normal. It was just an error. It was just an artifact. So this is bad. Or sometimes the other way of this artifact side effects, or we can say the not good representation, is that if there is an artifact, for example, posterior shadow artifact, that's a shadow, that's an artifact, or posterior enhancement, so that is one of the artifact we can say. So that artifact will hidden a lot of pathology below that, beneath that, posterior to that, because it's a shadow and you don't see anything. So you think, okay, it's a normal study. You send the patient with a normal study, and then maybe that area there was a tumor, maybe that was a malignant tumor, we don't know. And after some time, it will just maybe spread, maybe after 6 months, 9 months, a year, or a few months, it will just spread to the whole body. And again, we damage the patient because we didn't know that this is a posterior shadow or enhancement, but we cannot catch any information beneath that, below that. So that was also a mistake. Now, let's come to the assumptions. Let's talk about the assumption a little bit. Like I said before, there are 6 assumptions, which I mentioned them in my book also, Concept of Sonography. So there are a few assumptions. If the sound not follow, or if the sound violated from those assumptions, then the image will be there. You will get the picture, but the picture is error picture, a mistaken picture, a picture which is not talking reality, the picture which is totally a different picture. It's not matching to the anatomy. So for example, assumption number 1, in assumption of the ultrasound or sound or sonography, it says the sound is going in a straight lane. So if the sound has to go in a straight lane, now if this violation happened, like this assumption violated, how? If it bend, it just not go straight, it just go and bend to the other direction, it will give you the picture. but your picture will be artifact. For example, let me explain that on a whiteboard a little bit. Maybe that will make it a little easier. For example, if we just have, for example, if you have a transducer, for example, if here is a transducer, pretended it's a probe transducer. Okay, now you are scanning a structure, for example, a cyst or a vessel, but in a transverse shape. For example, here is a structure which is a rounded structure, correct? So now if the sound come, like we said, the sound has to go in a straight lane. It has to go in a straight lane and come back in a straight lane. That is the assumption. That is the rule regulation of the sound. That's how the sound works. Now, in case if this sound come to this area, for example, it just hit this border or that curved area of the structure. If it's a cyst, it's a vessel, if it's any rounded structure. So when they hit this area, what happens here? The sound will bend and it will go to the different direction. Now, it's supposed to go on this direction, correct? It's supposed to go straight, like we said. It has to go to straight line, but it's not. It's going to the different direction. So this bending of the sound, it will create artifact, and that artifact will be seen here. You will see an artifact, and normally we just call this artifact a shadow artifact, correct? So it's the bending of the sound actually. So sound violated here. That's one, like what we were talking about, that the sound has to go in the straight line. Number two. Now, we said that the sound is going directly to the reflector and come back from there. For example, let me give you another example. For example, let me clean this or erase this. Now, if you have another probe, for example, you have a probe here, transducer, and pretended you're scanning a urinary bladder. Just pretend it, okay? Now, we understand this is pulse number, and the ultrasound or the sonography, the rule regulation is it's all these machines or the scanners we're using most commonly, they are principle one. They equipped, they plan. The software is principle one. And what is principle one? Principle one means in each scan line, one pulse will come. And then when that pulse bring the information back to the system, to the receiver, then the next pulse will emit or fired. So if this system did not work correctly, properly, what does that mean? It means like this. Let me show you here. For example, this was a pulse number one. It just came to the bottom, to the floor of this urinary bladder. So they take information from here, the bottom of this floor. Now, this pulse is going back to take the information, correct? They're just taking information. So it comes here. Now, the second pulse fired ahead of time. This blue one, the reflection, it's supposed to go all the way to the receiver, and then the next one will fire. But the next or the second pulse just fired premature, ahead of time. So the second pulse, I will just do it with a green color, for example. So it comes and they met together in this area. They just met here together here. So the second pulse, which is the green one, that will take the information to the receiver and that will go up back to the receiver. And will tell the transducer and the system that the material I have, the information I have, it is here. They will represent it here. So how that works, it will be here. For example, this is your display, your screen, TV, you're watching that. So if this is your urinary bladder on the screen, so you will be experiencing some stuff in this area. Actually, this information was from the bottom here, from the urinary bladder or any fluid-filled structure, any that structure. It was here. It was just in the bottom here. But it represents on the wrong location. They displaced the information. It's just because the next pulse came prematurely. It just came ahead of time. So they did not wait for the first one to go complete the job, and then the second one will emit or fire. So they did not wait for that. And then we get, so that's why we said this is rule number second, that the pulse has to go straight to the reflector like here, and then after that it has to come back all the way here, and then the second one has to fire. So this is a violation because they did not wait for the first pulse to bring the information, complete the job, and then the second will come. So it's a violation. So that is another problem. We get this problem, and that is artifact. It will create artifact because the picture we see is artifact, because this will be represent like, okay, debris tissue seen and the structure. Actually, it's not. Or you're going to say, if it's a cyst, you're going to say a complex cyst seen. Or maybe you're going to say a septation seen in the cyst, for example. So actually, that was the bottom of the cyst. Or urinary bladder, or gallbladder, or any fluid-filled structure, anything. So this is called a range ambiguity artifact on the 2D imaging system. So that is another. Now, there is another problem, another violation. That was 2. Number 3. The third one is, we understand sound travel in soft tissue exactly in 1540 meters per second. That is the sound speed, propagation speed of the sound in a soft tissue. Now, anything more than this or less than this will create an error. Any speed. In a medium, when you scan somebody, abdomen, thyroid tissue, a body, anywhere in the body. So if the sound speed either more than this or less than this, that will create a picture which is error picture, which is not correct picture. That's an artifact picture in that case. So for example, let me give you this example too. Now, you're scanning from this point. For example, this is your transducer. Now, if you scan from here, and this is your soft tissue area, this area, and here you have a fluid-filled structure, pretended. So we understand the propagation speed of the sound in this area is that one, 1540 meters per second, and this is a fluid-filled structure. So here the speed is less. Let's put it as a 1100 meters per second, pretended this way. And now you really want to take a picture from the bottom, from here, for example, I can say from this area, correct? Just from here. This is a structure. You want to take a biopsy or take a picture from this area. Now, this structure is pretended in a 5 centimeter depth. It's supposed to be there. Now, when we hit the sound, when the sound comes, this speed of the sound till this area is normal, 1540 meters per second. But when they enter to the fluid area, so the speed will decrease, correct? So it's 1100 meters per second instead of 1540. So now they go slow. When they go slow, so it's about the time. If you guys remember we had a formula. The machine, the scanner calculate the depth because of a few formulas, like we have range ambiguity. We said calculation of the modified range equation, and also 13 microsecond rule. So 13 microsecond rule is most of the machine. It's like this, 13 microsecond rule. And what is 13 microsecond rule? When the sound pulse spend 13 microsecond, machine automatically understand that you got 1 centimeter depth. For example, 26 microsecond, so machine understand 3 centimeter depth. 39 microsecond, machine understand that will be 4 centimeters. So, sorry, this was the 26 is 2 centimeter and 39 is 3 centimeter depth. So the machine go by the timing, how much time the pulse spend, correct? So now, if this is the case, here the speed was okay. Everything was normally calculated by the machine. But when it comes to here, the machine is confused. So machine knows the pulse will take more time here, correct? Because speed is not like that fast like it was here. So this medium here, this fluid filled area, the speed of propagation speed of the sound is slower here now in this medium. So when you get this structure will be displaced and it will come somewhere in this area. So now it's overestimation because you got the structure, it's supposed to be here and now it's here. So on the display, on the screen, it's supposed to be in the 5 centimeters supposedly, but you see them maybe like in a 7 centimeter depth. So maybe this is a biopsy. Now somebody just doing ultrasound guided biopsy. When you're getting the biopsy, you are taking biopsy from this, maybe it's a tumor, maybe it's any suspected area for any malignancy, for example. So if you take a biopsy from here and you send it to the pathology department, and the result coming back, it will say normal cell seen, and it will not have any pathology because you took the biopsy from the right area. It was just the error. The machine give you the wrong direction, the wrong location, actually. So this is called speed error artifact. Or for example, the other way of writing is for this one is, so this was a slower medium on the way of the sound. Now, what if this area, this is an area where the speed is high speed in this area. It's more than 11. It's not like this much. Maybe now the speed is, I can say 1900 meter per second. Correct? So now it's more than 1500 in this case. So on that case, the speed, the sound will go with the speed too much. Now, sound spend less time in this area, but they went through that area. Now, this time, it will give you underestimated area. So this structure you see, it will be somewhere here. It will be somewhere above where it's supposed to be. For example, I will just draw here. So it will be like somewhere here instead of to be here. So now it is underestimation. So these are the speed error artifact. So we can tell, we can say that the sound is exactly, this is the propagation speed of the sound, 1540 meters per second. If it's more than this or less than this, our information is mistaken. Our information is not proper. Our information is an artifact, actually. Okay, so this is another one. Now, the next one is, for example, we said our pictures, the normal picture we get, anything you see in the main axis beam, anything we see in the main axis beam. So the sound or any reflection, only we see the structural position in the main axis beam. That is the real picture. Anything off the axis, like not in the main axis, it's off axis beam, then that is an artifact picture. We will see a real picture and we will see an artifact picture. So you will see two structures, actually. Sometimes it happens and the pregnancies also, like when you look for the early pregnancies and then the doctor says, for example, that happens that you have twins, and then it's actually an artifact, the second one. The one is real, the other one is just a picture, like a false picture. It's not a real picture. So it's not like a mirror image. It's kind of mirror image, but mirror image is a different mechanism in the mirror. That there we need a strong reflector for that one, for the mirror image to be created. You know what I mean? It has to be a strong reflector which act as a mirror. So that's a different story. Here, they are off axis. So we said that is also on picture of error, or we can say that is also an artifact. Now, the other one, number 5, I believe so. That assumption is, we said the sound beam is a thin, it's a thin beam. It's the beam of the sound that has to be very thin. That's assumption. If it's dilated, so any sound with the beam is more dilated, or we can say wider beam. For example, the easy way is we can tell like lateral resolution degraded. So what happens on that? For example, let me explain that also a little bit quickly. For example, so here we see, for example, we know that if you have a transducer, like pretended this is one of your transducer and you're scanning from this transducer. Now, we understand when the sound enter to the tissue, to the body, human or animal body, so they create a beam, you know? So this is called a sound beam. It will do the conversion and then after to the point, and then that will do the diversion. Now it depends. So if you are looking to the structure for the lateral resolution, if you have three structures, for example, 1, 2, and 3 structures. So these are 3 structures. But on the screen, on your display, you will not see them 3 structure. You will see them here. You will see them like one structure. And this is artifact. This is error. They will look like one structure. So you're gonna, of course, you will do measurement of your structure, and you will report it like this big structure seen. Any pathology, you're gonna report it. When the surgeon or another doctor whose field is that, when they open it and they find there are 3 or 4 or 5, 6 structures. So the scanning plan is very thin. When they become wider, they get the wrong information. So how to avoid from this problem? Try to put your focus where your interest area is, because the beam diameter will become narrow on the area of your interest of your study, which is, the region of interest. So just put the focus on that area. This way, this problem will not happen. If you have, for example, one structure here, one structure here, one structure, so now they will give you, because on the one area, because we are trying to catch this distance, that is our job. So lateral resolution, bring your focus at the area of the scanning. So if you make this and bring your, for example, if you bring your beam focus on that area, for example, you just made it here. So now we understand it will just go and be like this. Now you will see one structure here, one structure here, one structure, and now that will look like 1, 2, and 3. So the axis, or we can say the imaging plan is very thin. When they become thick, the problem will happen, and that is an artifact in that case. Okay, the last one, the last assumption. We say that the amplitude, or we can say the strength of the amplitude, is related to the characteristics of the reflector. Now, for example, which kind of artifact can happen in this area? For example, if we are scanning a fluid-filled structure, anything like a gallbladder, so you will see at the below posterior to gallbladder, you will see a very hyperechoic area. Correct? So you will see, because that's a posterior enhancement artifact. So you see the tissue is a normal tissue below that, but you see brightness. You see very hyperechoic. And that hyperechoic represent that tissue is a very stiff tissue. Really, like, it's really, molecules are too much close to each other. It's like a hard tissue. They're not hard tissue. Or maybe, for example, another reason is, if you're looking for focus. So where the focus is, most commonly we get that artifact. It's called focal enhancement artifact. Where the focus is, you will see by the focus, like vertically, you will see a long area of the brightness area. It looks like there's a calcification or like any chronic disease, because that will give you the reflection will be hyperechoic. That will be more brighter than it is normal supposed to be. So if you move the focus up and down, that will also move with it. So you can diagnose, that way. So these are some stuff we have to be careful, because artifacts are not a real pictures. Artifacts are always, it's error. It's a picture of, for example, we can say we cannot represent it as a pathology. So be careful with them. So I hope if these a few things can help you guys. Maybe some doctors, they want to sit for their ERDMS exam, CCI exam, national, international exams. So try your best to understand the concept of it, what it is, how it works, how it creates, how we can avoid from this. For example, like I told you, speed error artifact, how you avoid from it. So scan from a different angle, go from a different window. Do not use that area, because if you understand, okay, here can be the problem of the speed error artifact can happen. So just don't go from the area where the medium have a different echo texture. The medium have not like a soft tissue. So you can tell if there's a cyst on your way. So scan it from a different angulation, from different window, and then you will be able to see that there is no overestimation or underestimation. So once again, image which is not corresponding to the anatomy, that is artifact. And also, easy way to understand if this is artifact or is a pathology, if you see any picture, for example, kidney, you're looking for the kidney, and you think there is a cyst because you saw a rounded anechoic structure in one of the area of the kidney. So if you find that structure exactly, you saw it on all the plans, longitudinal or sagittal, transverse or short axis or oblique wave, then that's a pathology. Because artifact will be seen in one of the plane and the other plane, it will disappear. So that is artifact. And then this is the key thing. So then you can tell, okay, it's artifact. When it's artifact, just don't worry. At least mention it in your preliminary report or final report. And maybe your next doctor, another doctor, this patient was referred to you. So, or the one who maybe they have a decision for this patient, maybe like a surgery or something. So let them know that this, because you may send the pictures with them or a video or maybe like a desk or something. So the information with the pictures goes to your report, with your report, they will know like, okay, I already mentioned that it's an artifact. So they're good on that case. Okay, my dear healthcare providers, my dear doctors, or anybody who works in this field of the radiology, specifically in ultrasound field. So please, if you think this information can help you or somebody else from this field, please don't hesitate to share with them these information. So this way, I will get their comments and the YouTube channel. And please, one more thing, tell them to, if they want these more information like this, so tell them to subscribe the channel and they will get the notification for the upcoming videos. And also, if you have some other questions, because I'm going to have some practice test questions, quizzes, and also I have some books written by me. So you can go and search on the, you can see here also www.ecomedicalcenter.com. You can just also search there. If you like it, let me know. Thanks a lot and have a great day. Just wait for upcoming more videos. Thank you and have a nice day.